Well, we welcome you all to this edition of Dissect Interview, and today we have the honor of talking to Dr. Cheryl Bayart, who is all the way from Cleveland, Ohio, USA. So if I may just proceed, that I'd like to introduce her a little bit and talk about a professional appointment. She's from Cleveland Clinic Foundation, Cleveland, Ohio, USA. Associate staff pediatric dermatologist. Then Cleveland Clinic learner and Case Western University Schools of Medicine, Cleveland, Ohio, and assistant professor of medicine. Why are you writing application pending?
I have some paperwork to finish.
Yeah, why?
I just have some online applications to finish.
So, Dissect wishes you congratulations in advance.
Thank you.
All the best wishes it has in its pocket, right? So, Dr. Bayart, now let me start this interview. Welcome to this country, welcome to Nepal, and it's really, like I said, an honor for all of us here at Dissect, and more so at the department, Dissect Media and Communications Department, in short DIMCD, that we have you here for an exchange, for an interaction, and that we'd like to know some information about you. So if you allow me, then I would like to pose my first question to you. Dr. Bayart, why did you choose this profession? Why didn't you become someone else than Dr. Cheryl Bayart?
Well, it's kind of a long story. I majored in English and French in college. In the US, you go to college and then you choose graduate school if you'd like. And I was a teacher in France for 2 years after college. And I was teaching lots of students from Africa, from different countries, and started to look into the public health issues they were facing at home and realized that I wanted to do more for them than teach them English. And so I decided to go to medical school and at the same time get a master's in public health to, really help people on what I think is the most basic level.
So that was the kind of a thing, it was a God-willing subject that you really wanted to get into it. And then, very interestingly, you are telling me you were a teacher?
I was.
And a teacher becomes a health officer or health, caretaker and so on. Well, congratulations once again for changing the profession so successfully.
Thank you. I use my teaching every day.
Oh yes, you do that. All right. Now, so far as I gather, Dr. Bayart, you are not, let's say you didn't come here as a private person, but you chose an organization, and that is HVO. Can you tell us a little bit about how this institution is functioning?
So Health Volunteers Overseas is an organization based in Washington, D.C. in the USA, and they help coordinate people, doctors, healthcare providers from the U.S. who would like to travel where they are needed most and coordinate partnerships with the places that need them most. So I actually became aware of this opportunity through some colleagues in pediatric dermatology who helped develop the partnership with the institutions here in Kathmandu. And the Health Volunteers Overseas has really put the logistical framework into place to make it happen.
So let's try to make a sort of a comparison. Well, I may sound not very professional if I do that, but in France they have got Médecins Sans Frontières, right? Am I pronouncing correctly?
Parfait.
Oh yes, and then HVO. What is the similarity between these two institutions?
Yeah, so that's a great question. So Médecins Sans Frontières, Doctors Without Borders, they tend to, I have quite a few colleagues who have done projects with them. They're longer term projects, typically 6, 9, 12 months, sometimes longer in a place. Usually, a lot of hands-on caretaking in addition to teaching. Health Volunteers overseas tends to do shorter term projects, which, given the restrictions of the kind of professional appointments that I have, is really more feasible for me at this point in my career. So a week, 2 weeks, they're starting some longer term projects, I believe up to 3 months at this point, but really shorter term projects, but nonetheless longitudinal projects, like with the Doctors Without Borders, in terms of sending people over in sequence to keep projects going, which I think is really, really important, and working with the people who are in the community and practicing in the community.
Yeah, thank you. Let's talk about the timing of the visits by the doctors who come through HVO. Don't you think, you are here for just a couple of days?
8 days, yeah.
8 days. Is that the normal span of time for doctors being sent by who come under HVO?
I believe so. I believe that's pretty standard. Some might have more like 2 weeks, but typically for my kind of position in the US, we get 4 weeks total of vacation per year, and this counts as vacation. It doesn't count as work. So longer than that becomes very difficult with our clinical and teaching responsibilities in the United States.
Let me now remember or tell you that we had one lady doctor, pediatric dermatologist from the University of Toronto, Dr. Irene Lara Corrales, whom I had interviewed also here in this very room. And she also told us very interesting things about the movement of people, of doctors being sent here and there. And now, let's come to your Nepal visit. Why did you choose Nepal as your destination for field visits?
So initially it was chosen by 2 other pediatric dermatologists, Anita Hagstrom and Neil Prose, who developed the partnership with DISHARC and really piloted this program. And they made an announcement at one of our national meetings. Pediatric dermatology is a very small world. There's 300 of us in the US, which sounds like a lot, but there's almost 10,000 dermatologists. We're a small group and we all know each other. And I am very interested in international work. I'm very interested in teaching. It's always been my dream to come to Nepal. I said, well, that sounds like a perfect opportunity made for me.
Yeah, we are also really fortunate to have you in this institution. It's not that a person, Dr. Cheryl Bayart, just visited us, say, hello, how are you? Are you fine? Well, I'm doing fine in the United States. How are we doing fine in Kathmandu? But there is a purpose. Well, let's say then we are talking now about your field visits. Like you came over here and you just visited some of the health institutions around. Tell us a little bit about that.
Yeah, so it's been a busy but truly amazing trip. I started out the week here at DISHARC working with Dr. Karki in her clinics. We did some procedures that day, clinic visits. I went to Nepal Medical College and got to spend the day with the residents and dermatologists there, which was excellent. I also went to Kathmandu Medical College, same thing, opportunity to work with the residents and also the teaching dermatologists. really kind of the environment that I really thrive in is that teaching environment. Yesterday, a group of us from Daishar, Dr. Karki, led our group to a camp at a monastery about an hour from here, where we saw about 50 children, and it was a once-in-a-lifetime experience. So I feel like I've gotten to experience really a tremendous scope of different practice settings here in Nepal, which has been, I feel incredibly lucky.
So you enjoyed the camp yesterday?
Oh, yes.
Then, you see, Dr. Bayart, what happens normally is when people come over or visit a particular country, well, it's a beautiful country, they say, and they also tend to find, my God, something has gone wrong over here. This should be corrected. That should be corrected. Do you have any ideas on the corrections to be made in terms of dermatology or handling of dermatology in this country? Any suggestions?
Yes. My number one suggestion would be that high potency topical steroids should not be available over the counter.
Mm-hmm.
In the US, we kind of go the other end of the spectrum. There's nothing stronger than hydrocortisone 1%, the weakest steroid there is available over the counter. But I have seen so many patients here with sequelae of super potent topical steroids who are able to buy them without the counseling.
Sorry, you are talking about the typical medicine you had mentioned, obtaining without a prescription, right?
Yes, they're able to obtain it without a prescription. It's available, which can be dangerous.
Yeah, all right. Now look, you just heard Dr. Cheryl Bayart, giving some suggestions to the counters, not to issue. What medicine was that one?
So super potent topical steroids like clobetasol, betamethasone.
That should not be given away to persons or patients who come to the counter without prescriptions. This is the suggestion you want to make, right?
Yeah, and I think the dermatologists I've worked with here would agree that it's not a helpful thing. People get severe side effects. Also, people don't know what they're treating. Just someone buying it in the pharmacy isn't a dermatologist, isn't going to know what kind of rash they're treating, and in the case of infection, it makes things much, much, much worse.
Dr. Bayart, we are really grateful to you. You know why? Because you are not mentioning about the negative one, but you are just imparting a very big suggestion. I mean, it's a suggestion worth, I would say, billions of dollars to a character, to a system, to a habit where very dangerous medicines and drugs are being issued or handed over or given away without the prescription. We too also believe, personally, if you ask me, I also believe that these dangerous drugs should be kept within the limitation of our prescriptions and so on. That was a very good suggestion you made. You have some more? The reason why I'm asking you, Dr. Bayart, is we want to learn from you.
Yes, yeah.
Actually, we're not trying to say that you criticize this and criticize that. We want to learn from you. We want to say where we are wrong. This should be corrected. That should be corrected. That's why we are requesting you to tell us more.
Yeah. I think that was really the biggest thing that I've noted here. I think there's truly excellent dermatologists here. There are very good training programs. I am impressed at the quality of the services here. The last thing that was interesting to me, and I don't think it's right or wrong, but in the US we have a little bit of a different setup where the doctor comes to the patient and the patient stays in the room and the doctor moves from room to room, whereas here the patients come to the doctor, and the doctor is fixed in one room. And what that allows me to do is to have the patient undressed completely before I see them. So I am able to do a complete head-to-toe skin exam pretty quickly on every single one of my patients. The way things are set up here, it's much more difficult to do that, and I find a lot of patients are very reluctant to remove their clothing, and I think that we miss things if we're not looking everywhere.
Yeah, good that you tell us. Did you tell all these things? Did you suggest these things to the concerned people and doctors or dermatologists you met during the stay over here?
Oh yes.
And what was their reaction?
Yeah, so I think everyone is in agreement about the steroids, and just nobody, it's really an issue of government regulation of these medications. And certainly there's a lot of money to be had for the people manufacturing them if they are so widely available. So I in my experience in the US, when money comes into play and politics come into play, it becomes difficult to make changes. I think it's the same here.
Well, I wouldn't say that you are speaking wrong. This is exactly what Dr. Irene Lara Corrales from the University of Toronto, when she was here in Kathmandu, she just told me in that interview too. She said, well, Mr. Chand, you go to a pharmacy over here, and the person who's dealing with the medicine. You go there, and then through friendship or so, you get the drugs without having to forward any prescription on the table. This she found also too bad. And also a valuable suggestion you are giving to us. Thank you very much for that. And what did you find, let's say, a happy note about the medical system over here? Or dermatology system,
On the flip side, I think patient access to prescription medications and to medical care is really excellent. In the US, people complain about the waiting time to see a dermatologist. In some places, it's, months that people have to wait when they have a skin problem, whereas here, I don't get the feeling that anyone's been waiting that long. They're able to get people in quickly for follow-up. I would love to see many of my patients after a week, but I just can't. My schedule is booked, and here they make it happen, which is impressive. There is no barrier with private insurances like we have in the US, telling the doctors, no, we want you to try this other medicine first. The doctors are allowed to treat patients how they want to treat them, which I think is really wonderful. I think there is a wonderful atmosphere of collegiality. The people working together, teaching, and welcoming these suggestions, and reaching out to different institutions and cultures and countries, and taking the best of it. And the dermatologists I work with here are very well trained and are really excellent at their jobs, and I learned a lot from them.
Well, thank you for that. So are you going to stay here in Kathmandu, or do you have any plans to go out of Kathmandu, or are you visiting some other places?
Yeah, I do have plans to go out of Kathmandu. I leave tomorrow.
To?
Veti Sahar. I'm going to hike the Annapurna Circuit while I'm here. And so I actually won't be flying back to the US for another couple weeks.
Yeah, all we want to tell you is bon voyage.
Merci.
Yeah, bon voyage to that beautiful place where people go on trekking, come back and go back home with good memories and so on. So my final question would be, now, what are your impressions about Daishak?
So I am impressed to find such a large private practice here, with so many dermatologists and so many resources. I didn't expect there to be lasers and so many surgical procedures going on. Very impressed with that, and I'm very excited that Dr. Karki is interested in developing an expertise in pediatric dermatology, which overall is just a very new field, and I think a lot of places don't have that. Even in the US, there's a lot of places that don't have that, and I think that that is going to be a huge asset to DISHARC. She, I know, has partnership with the local pediatricians as well, which is essential. You're really managing pediatric dermatology patients is multidisciplinary. So I think that's extremely exciting.
Well, that's great what you are saying. And well, we're also really very happy to hear from you. I mean, well, these are the words of honesty, Whenever people talk, interactions are there. You have given so many suggestions, and certainly it is for the authorities of the year, to adhere to and so on. Well, that's all what we want to know from you, Dr. Cheryl Bayart. Thank you very much for being with us today. It was really a very exciting meeting with you, and we also thank you for this interaction, or this interview, let's call it. Now, you just heard me talking to Dr. Cheryl Bayart of Cleveland, Ohio, USA. Like I've given already the definitions. Cleveland Clinic Foundation, a repetition, Associate Staff Pediatric Dermatologist, Cleveland Clinic Learner, and Case Western University Schools of Medicine, Cleveland, Ohio. And of course, an application is pending. By the time this interview is at, I don't know, but we wish you all the best, Dr. Cheryl Bayart, that you become the Assistant Professor of Medicine. All our best wishes are with you. Thank you very much.
Thank you.